Understanding RSV symptoms, risks, and prevention tips for a healthier winter. Respiratory Syncytial Virus, or RSV, is a common viral infection that targets the lungs and airways. It's most prevalent during the colder months, especially in December and January, when people tend to gather indoors. The virus spreads easily through respiratory droplets when someone coughs or sneezes, and it can also be contracted by touching contaminated surfaces. Now, while most cases of RSV cause mild, cold-like symptoms, it's important to note that certain groups are at a much higher risk for severe illness. These include infants under 6 months, older adults, and individuals with weakened immune systems or underlying chronic conditions. RSV can lead to serious complications, such as pneumonia or bronchiolitis, especially in these high-risk groups. So, what exactly are the symptoms of RSV? Typically, RSV symptoms appear about 4 to 6 days after exposure. It often begins with a runny nose, sneezing, mild fever, and cough, which may seem like a common cold. However, as the virus progresses, symptoms can worsen. Some individuals may develop wheezing, difficulty breathing, or other respiratory issues. For infants, additional signs to watch for include fussiness, difficulty feeding, and trouble sleeping. In more severe cases, infants and elderly adults may experience rapid breathing or a bluish skin tone due to a lack of oxygen. This is a clear indication that medical attention is needed. So, how do healthcare professionals diagnose RSV? RSV is primarily diagnosed based on symptoms and medical history. However, in some cases, doctors may use a PCR test or a rapid antigen test to confirm the presence of the virus. These tests are particularly helpful in determining RSV infection in children or high-risk individuals who might require more intensive care. Now let's talk about how RSV spreads. RSV is highly contagious, primarily spreading through respiratory droplets when an infected person coughs or sneezes. It can also spread by touching surfaces that are contaminated with the virus, and then touching your face. Because of this, crowded spaces like schools, daycare centers, and holiday parties can be hotspots for transmission. This is why extra care is needed during the winter months to avoid spreading the virus. So, what can we do to protect ourselves from RSV? Preventing RSV largely comes down to practicing good hygiene. Regular hand washing, especially after coughing, sneezing, or touching shared surfaces, is one of the most effective measures. Additionally, avoiding close contact with sick individuals and staying home when you're feeling unwell can help prevent the virus from spreading. It's also a good idea to disinfect high-touch surfaces frequently and wear masks in crowded spaces, as this can reduce the risk of transmission. But who is most at risk for severe RSV infections? While anyone can get RSV, certain groups are more vulnerable. Infants under the age of 1, particularly those born prematurely, are at the highest risk. Older adults, especially those over the age of 65, along with individuals who have chronic health conditions, such as heart disease or asthma, are also more likely to experience severe symptoms. For those in these higher risk groups, preventative treatments, like RSV immunoglobulin therapy, may be recommended to reduce the severity of the infection. But what about strengthening our immunity naturally during RSV season? In addition to medical measures, there are some natural remedies that can help boost your immune system and provide extra protection. Honey and ginger tea, for instance, is a soothing and immune-boosting drink. Ginger helps stimulate circulation, while honey has natural antibacterial properties. Simply steep fresh ginger in hot water and add a spoonful of honey for a comforting drink. Chicken soup is another remedy known for its anti-inflammatory properties. It can help ease congestion and provide warmth, making it especially beneficial during cold weather. Garlic and lemon are also great ingredients for immune support. A simple drink made with warm water, a squeeze of lemon juice, and a clove of crushed garlic can strengthen your body's defenses. When should you seek medical attention? While RSV is typically mild for most, it can cause serious complications in high-risk individuals. If you or your child experience significant difficulty breathing, a high fever, or signs of dehydration, it's important to seek medical care promptly. For infants, look out for rapid breathing, chest retraction, or a bluish skin tone, all of which indicate the need for immediate medical attention. So, in conclusion, how can we stay safe this RSV season? RSV is a common virus, especially during the winter months, but it can be severe for vulnerable groups like infants, older adults, and those with chronic health conditions. By understanding the symptoms, risks, and prevention strategies, you can take steps to protect yourself and those around you. Remember to practice good hygiene, avoid close contact with sick individuals, and consider strengthening your immune system with natural remedies. And most importantly, if you or someone you care for begins to show signs of severe illness, seek medical help immediately. By staying informed and following these precautionary steps, you can help ensure a healthier and safer winter for everyone.